All right, we are going to continue on with chapter 12 in fundamentals, and we are going to start up with the culturally based approaches, and we're going to hopefully identify a level of respect here and make realistic decisions on how we present our proficiency as a massage therapist with these particular methods. So let's share the screen. And here we go. All right, so a lot of culturally based approaches and your Asian and Eastern methods, most understood, is the idea of points and lines, and that being part of the medicinal practices of many ancient healing traditions. And I think it was the mummy that they extracted from the Alps, that they noticed that there were tattoos around various joint areas. At first they thought it was decorative art, but then they started to look at it a little bit more and thought possibly these tattoos were related more to a treatment process for something to do with the joint, because they weren't really decorative, they were just there. So that'd be a needle insertion of some type, and then a map on how to push on these or whatever to get some relief from joint pain. So it's a different looking at the body this way in its own unique form and function, and the language that goes with that. That's the real differentiation. And these systems are complete systems unto themselves. They are a full approach to health and wellness and medicinal or treatment orientation. They take an extensive amount of study in the methods, but also the assessment, the diagnosis that they have unique to their system, and the treatment. So I ethically become concerned, perturbed is probably more better word, when somebody will have, in an entry-level massage program, they'll have Shiatsu, and it's a weekend. And that, again, is an example of one of these complete systems. Or they'll teach acupressure, and that's doable to teach a few acupressure points, but it's not really indicative of the full system here. So the purposes of having this in the textbook are to talk about the system itself, because we may have a referral back and forth with this, to identify an overlap in benefit and mechanisms possibly of action, to appreciate another language structure and thought process, and to maybe have one or two procedures that we can make use of in the massage system. The intent is not to teach you to be an expert in traditional Chinese medicine or Ayurveda or any of that. It's to find some of the level of common ground. So that's what these objectives are talking about. And acupuncture, by the way, is something that is pulled out of the entire traditional Chinese medicine system, and being practiced separately. And I think just like when you extract essential oils, when you pull something from the whole, you are missing out on the more subtle and more integrative concepts of how that system works. So, but this is what is being accepted most in Western society, is the idea of the acupuncture. And so we're thinking about points and lines, and the lines tend to line up with the major nerve tracts. And we're thinking about balance, homeostasis. So we have the autonomic nervous system and the somatic nervous system, and in traditional Chinese medicine, they have the idea of yin and yang. And here's a diagram related to the 12 main meridians, and then the direction of flow. And while you won't be specifically tested on this on the MBLEX exam, I think it would be a fun study for you and an informative study to match up these lines with the various compartments, functional muscles, soft tissue compartments, and where the nerves run, so that you can start to see the overlap. I'm not saying for sure that is the nervous system that is actually reflected here. I think it's probably much more. Some of it concrete, a lot of it not. But that doesn't necessarily interfere with the value of this type of a system. And this box right here gives you a little bit of insight into symptoms that might show up if there's an imbalance in this meridian structure. And they tend to organize themselves in a yin-yang pair that shows up in the 5 elements. So might be worth a good read through here. And then this metaphoric description of observable phenomenon in the world and how it might be used to help understand stuff that cannot as easily be seen, like autonomic nervous system function. So there's a control cycle, and there's a creative cycle that goes with this. And the legend here on this figure kind of gives you an idea of that. And so this is a way of thinking. This becomes a critical thinking process. And it's pretty elegant when you stop and look at how the correlations or how the metaphors developed. And then this table shows you some of the expansion. So here are your various elements, and what's the yin meridian and the yang meridian, and what's the sense, smell is the sense connected with that, and all of the different elements that they would look at if they detected, a practitioner detected that there was an imbalance in that element, and then how it would automatically interact either through the controlling cycle or the creative cycle. It's pretty cool. But it is way too complex for an entry-level massage student to do more than have an overview with it. And we have to own that. We have to appreciate what's reasonable and what is maybe something that we put on our list for further study. These Asian systems also have activity, exercise, that our culture, the Western culture, has taken a look at. I particularly like Tai Chi. It is a lot about balance and moving a joint through its range of motion, and it has breathing as part of it. But it is a discipline, and it takes time. One of my teachers / friends is from China, and she had a very in-depth study of Tai Chi as well as traditional Chinese medicine, and she tried to teach me Tai Chi, and I picked up a few of the methods, but I was really not very good at it. And she finally told me that I wasn't going to be very good at it. She also taught Luke, and Luke is very good at it. So it doesn't mean I can't appreciate the value in these types of movements. And then this gives some idea how we might be able to incorporate the idea of the points into our generalized massage therapy approach. So Shiatsu is very similar. There are some variations, though. It is more out of Japan, and not nearly as old as traditional Chinese medicine. So much of it was borrowed and then kind of uniquely formed along with some Japanese philosophy. And so it's nice to compare and contrast the two. But the points, the lines and points are very similar. And they work off of the idea of deficiency and excess, not enough and too much. Well, that's the foundation of imbalance and homeostasis, is not enough someplace and too much someplace else. And then how do you regulate that? And of course, there's a language that goes with that. And then Thai massage, that there's a culturally based healing system that overlaps, and it's culturally focused in Thailand, but it's inclusive of traditional Chinese medicine, Shiatsu and Ayurveda, and so it has what has been pulled from it the most is mat work, or working on the floor, and overclothing and some stretches and stuff that go with that. Some of those I think are, same with Shiatsu, I think they're too aggressive initially. Most people would need a much more graduated or graded approach to these things. So there is a potential for injury there if we are too aggressive with some of these moves. And then there's Ayurveda, and Ayurveda is typically where we're going to get the overlap of the idea of a chakra, which can be related to some of our autonomic nervous system plexuses and with the endocrine system. So that's kind of cool to see that overlap as well. So what this picture is some comparison. One person is thinking Shiatsu and the other person is thinking Tai. But if you don't know what they're thinking, the moves are the same. So the difference is what's happening in the intention and the thought process and potentially the forms of assessment, not necessarily in the application. So this is an overlap of the various identified points and lines. And as you can see, there's, again, a lot of relationship there. Dr. Chadal, my teacher mentor, would say, you know what, the whole body's a point. And can you just visualize that? So a lot of these points congregate around the fascial anchoring points that are located around the joints. And I had said, slow down there and pay attention, hold those down and move the body through them. If you were to overlap, especially on the torso and on the legs, you're going to see that there's overlap there, which is good. It's good that 4 or 5 systems and thought on a physical level are very similar. So what we need to do is be respectful of that and watch our terminology so that we are not inadvertently presenting ourselves as an expert in the cultural system unless we have undertaken the discipline to go through all that training. This is a fun picture that looks at the various traditional chakras and the color that goes with it, the correlation of the musical note, the emotion, body, mind, spirit overlap in it. And the caution I would give you on this and any of these methods that have a very active, overarching spiritual component to them, body, mind, spirit, whole person systems, this can feel like a religion, and the tenets of it may not be acceptable within that religious pathway, and then it can be rejected because of that. So I'm very cautious about how much of this information, I've got a lot of information in this, and I use it in my internal critical thinking process, but I'm not very overt with it. I'm practicing in a Western framework and teaching in a Western framework. And so it's important to know this, but you might put some people off. Some people might not feel comfortable around these types of philosophical ways of thinking. So just keep that in mind. And then here's some color associations as well. And you might want to take a look at these when you think about what kind of a uniform, color uniform, or how you might paint your walls or something. There has been some research in how the body responds. These are frequencies, how the body responds to light, which is color and light on the spectrum. And then this weaves into the biofield. And this again can create a lot of confusion. These are usually based on no touch or extremely light touch. And so do not fit in with the definition of massage. And while in the science is looking at this and unraveling some mechanisms that may be represented in some of the thought and philosophy around the more energetic concepts, these are, again, systems in and of themselves that can be easily integrated into massage, and most commonly shows up in our idea of focus and attention. So there's been a lot of different brands of this. Common right now is Reiki, but the polarity is the one. Polarity therapy is the one based on the work of Randolph Stone, where there's actually a criteria for knowledge structure and a certification, an actual certification process for this. So it's not new, and you can read through this. I think that if we take all of the language off it and just look at what is done and understand that there's an intention in massage therapy application for wellness and calmness and compassion and nurturance, I don't see that there's an inconsistency here. It's when this system is pulled out or there's a tremendous amount of overt emphasis put on it that you got the same issue where it can be confusing and inconsistent with somebody's spiritual discipline, and you want to be very respectful of that. So these are some possible, maybe plausible explanations for this. And this book expands on the polarity idea because it has its own unique certification process to it. So here are some of the concepts with this. And it's good learning to see the overlap and the differences. You certainly will see overlap to the 5-element theory when you look at this. And, you know, this idea of body energy and currents and flows and all that, I truly think they're probably going to show that happens. And then it's really going to challenge the disciplines that have used that as a premise and how they try to reconcile the historical cultural aspect of that with what the science is showing. So nice to read through this and get an understanding of what that is. Now, what I have done, and you will practice, is kind of an overlapping holding where we're actually touching and rocking and shaking method that can be done over the clothing that fits in with the massage paradigm, but has an undercurrent of some of these various methods that we just talked about, whether it's the bioenergetics or it's the cultural systems, because you can overlap them, like we saw in that one figure, and the places that you put your hands or you concentrate your focus are pretty much all the same. And finally on this is reflexology. And this is another one where there is a biologically plausible reason why massage on the foot is going to have a lot of sensory input into the system that's going to interact with the whole neurochemical homeostasis regulation idea. And this too has its own certification body. And so you want to be respectful of the uniqueness of this body of knowledge. And this segment is not teaching you to be a reflexologist, but it is showing you the overlap and giving you an idea of another view on why thorough massage of the feet and hands, where there's a lot of sensory input and a lot of joints, so a lot of mechanoreceptors might be effective, and why we want to make sure we do a good job on the hands and the feet. These are a few more polarity pictures here. And then here is our reflexology. There's a bunch of different charts. And one of the reasons for that is that they don't, everybody wants to avoid copyright restrictions. And so they each have to be presented a little bit differently. But they're all pretty much the same. And so the theory is that with the assessment, if you use a methodical method to work through all of these areas and you get a positive response, usually hypersensitivity, then there's an indication that that could be related to the representative part through a reflex mechanism. And then if there was pathology in the area, this represents the gallbladder here, then massage of that spot should send some sort of normalizing signaling through the central nervous system. I don't know. This idea has been around forever. It's been part of the Chinese system forever, traditional Chinese medicine. It was originally brought to the Western world by a number of people, but a person that wrote a book about it was Unisingham. Like everything else, I don't know if there is a direct link between an eyeball or the lung or whatever. Just like I don't know that there's a direct link between the gallbladder meridian and certain emotions that go with that. It doesn't mean that I don't touch those areas with the hope that there's going to be enough productive stimulation that the body is going to be able to find its best functional balance. And I will, if I'm doing good thorough massage of the foot, which means you do work through all of the tissue layers in the bottom of the foot. And there's many joints in here. You move all the joints, and you know, I will, if I get a person that is reactive in an area, I'll stop and think about it. So in general, this area right through here, where the foot will narrow, let me bring this size down a little bit. Of course, that's going to mess up. Well, maybe not too bad. Trying to find my picture. Okay, here we go. All right, so here we go. right in this area right here. So this is representing the front side of the torso. This is all about the torso and the head, neck, and torso. All right, this is your waist right here. And more towards the middle here are all of your organs. So your heart is on left, right. Okay, so your heart is on this side, left, here, and the liver is on the other side. So liver side and heart side. So see, dyslexia. And the organs that are here, for the most part, are going to be located in the thorax. Now, sometimes the stomach is down here, and in this version, it's up here. Sometimes the ears are on the toes, and the eyes are up here. But metaphorically, if you think of this as a reflection of the anterior torso and head, then you can just, this would be the midline, so this is the spine. And if you're doing a good thorough massage along through here, you can kind of visualize, okay, this was on the left and it was above the waist and it's further away from the midline, and you know, so that's probably the representative area through there. The outside and this is the sole of the foot. The outside and the top of the foot would be more reflective of the limbs. So if somebody has a shoulder issue, maybe this area, right under the little toe and to the side of it and over on the top. You know, there's a lot of charts. Just go to Google Images or Bing Images or whatever and put in reflexology chart and you'll see a ton of them. So I know and can comfortably speak that there are a tremendous amount of sensory receptors on the foot and in the joints. And there's also motor response back. This is to do with posture, movement, and walking, and all of that. And so I just feel like it's really important to do a thorough massage of the foot and the hands, so that we work through the various tissue layers. We pump those plexuses that support fluid movement with compression and lift, compression and lift. We move all the joints within their normal range. And that's what you're going to see in the examples that follow here. So there is a system that's used primarily in a palliative way called the M technique. M technique, the letter M and technique. Google that or do a YouTube search, and they're concentrating palliative massage using a very deliberate sequence to the hands and feet. And its outcome is comfort care. That's the focus. And it's a protocol, a pretty rigid protocol that is easy to teach lay people too, like family. And it's focused in these areas because of the limitation of adverse effects, easy access, especially in a long-term or hospital-based setting. But it doesn't work any less effectively on the clients that we are going to be working with. So these are examples of working with the foot prone. You learned that side lying, now the position of side lying, is better body mechanics. Sometimes a reflexologist will have somebody in a chair, like a lounge chair, and they're where they lean back and relax, and then they focus the treatment right on the foot. So this ends up with foot in the door. So sometimes in spa menus, they will separate out these various approaches a little bit. If, like, for example, if somebody's, you're interviewing for a job and they say, can you provide reflexology? Then an answer would be, in my entry-level training, I was exposed to I learned about the theory of reflexology. I practiced a very basic routine with it. I understand the importance of a thorough massage of the foot, but I do not carry a certification in reflexology, and they probably aren't going to care. And most of the time when people ask for reflexology, what they're really after is an experience where they get a thorough massage with the feet. But you need to clarify that so that you know, and if somebody is expecting a specific reflexology approach, then either you need to commit to go getting that training and that certification, and or you need to refer. I would say to the person, if you would like, you can experience how I include massage of the foot into the general massage protocol and see if that meets the needs that you're after. So, gotta get to that. For some reason, doesn't want to give me the next page there. There we go. I can't get to my little arrow here. Oh, there it is. Click it before I lose it. So as typical, when we get to the end of a chapter, we're going to have our summary. And here's some examples of how you can include little bits of the methods that we talked about in this chapter and have practiced. You've got your recommendations for learning more on the web, and I gave you some ideas of some Google searches or other search program that you can take a look at. And we have all of our references that go with this. That's always important. And then we have our multiple choice questions, and how we also have some access here to the various answers. I am starting to realize, and I understand how it happened, that some of the features that should have been totally moved to evolve, that did not happen. This book went to print just as the pandemic was occurring. And so the answers typically for these multiple choice questions in your workbook, etc., they are found for HEC students on Canvas. And then if you're just looking at Evolve, under content updates. But it's okay that the answers and the rationales are here along with aspects of the workbook. So things are not perfect. but at least the information is included in multiple places instead of eliminated. So this is going to take us to our next chapter, which is going to be very interesting in relationship to how do I want my massage therapy practice to look? How do I want to unfold that? And where do I want to work? And do I want to work alone, or do I want to work with an interdisciplinary team or with other massage therapists? And so this chapter will refer back to a business chapter and some of the information we can get there. So I am going to stop the video and just remind you that there's a lot of overview preliminary information in chapter 12, enough things that you can do and adapt so that you can use elements of these various systems, especially the ones that I think should maybe not have been totally pulled out in and of themselves, but it has, and there you go. And how you can respectfully take a look at some of the cultural systems and look at overlap into the Western idea and incorporate a few of those methodologies and also know when to refer. So big chapter, and we know that with how these books are written. And you, again, I'm just reminding you that you are responsible for your own learning, and there will be additional video support on the methods discussed in this chapter, as well as hands-on practice during your class application, when you're in class. So very cool. So 4 videos for this. So there's a lot of individualized data. Okay, we will end this now, just when the neighbor starts to mow their lawn.